episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hi there, welcome to Doc Talk. Doc Talk, if you remember, is the podcast that the Knoxville Academy of Medicine puts on for talking about health issues that involve all East Tennesseans in plain talk, so that we understand our bodies better. And I'm so glad today that we're welcoming Dr. Elmer Pinson to talk about regenerative medicine for people like myself, who is a weekend warrior and always breaking down bits and pieces of my muscle, bone, or whatever. So Elmer, thank you so much for joining us today.
No problem.
Help us weekend warriors.
Okay, very good. So a lot of my practice, I'm a physical medicine rehabilitation specialist, and I do most of my practices usually interventional spine, musculoskeletal with pain management treatments, but I also do some sports medicine as well, some regenerative medicine techniques.
I think you understand us so well because not only you've been trained to do regenerative medicine for us weekend warriors, but you've done how many Ironmen?
19 Ironmen.
19 Ironmans. That's just, I can't even, it hurts my body just to think about doing one Ironman. I can't imagine doing 19 Ironmen.
Yeah, I can't imagine either, but I did them. And the process I actually started when I was in medical school. And in medical school, I've always enjoyed sports, just like you do. And so when I was in medical school, I started weightlifting, so I was more of a power lifter at that time. And then one day I looked at myself in the mirror and I said, wow, who's that guy? And so I didn't like the aerobic capacity I had back then. So then I said, well, being type A personalities like we are in medicine, I said, well, let's incorporate a good sport that'll allow me to reduce the weight, but at the same time be able to get some of the aerobics. And so what's wrong with swim, bike, run? And so then I started out slowly and then gradually got up to a point where by the time I finished training, I would increase it to a sprint triathlon, and then an international triathlon, and then I started incorporating some half Ironmen, and then the full Ironman, and so it got up to 19. And so, I enjoy the challenge. It's definitely something I can relate with people that come into me and they say, oh, gee, I'm hurting because of this. What can I do? And I said, well, this is what I would do, and this is what I do. And as a result of that, there's a lot of us who are weekend warriors who, enjoy the thrill of sports or endurance types of events that want to keep doing them as we start to age and as we start to live longer and so forth.
Well, I think exercise really has kept you young.
Yes.
To a certain, it's part of your life.
Right.
And it keeps you healthy. Okay, so knowing that, how important is warm-up to keep us from injury?
Absolutely. So warm-up is very important. I think stretching, the concept of stretching before, after, trying to incorporate some blood flow in your musculoskeletal system is very important. There are a lot of overuse injuries. I cover as part of my role, I'm on an editorial staff for a magazine called Practical Pain Management, where I cover overuse sports injuries, especially now, even in the younger population. There's a lot of the youth right now, which basically, instead of as we grew up, we would have like 3 sports per year. These days, coaches prefer that they stay on one sport the entire year. So a lot of these younger population develop a lot of these tendonitis type issues, where because they're playing the same sport, they're not giving their muscles a break, like let's say in triathlon, where I'm swimming, I'm biking, I'm running different times of the year, even off season, you try different sports. Let's say
cross training too.
Cross training. So I'm a big believer in that concept. It tends to minimize some of the overuse injuries, some of the runners who develop plantar fasciitis because they're running all the time. They're not giving themselves a chance to recuperate, and they're not stretching. So I think a lot of that needs to be incorporated into the routine. Plus, I'm a big proponent of physical therapy as a concept. Chiropractic, I think, works, but I think therapy as a concept works very well. There's a lot of home stretching devices. If you go places, and a lot of the sports stores will have certain devices which will stretch your tendons and so forth when they get tight. I think some of the roller bands and so forth are very helpful. So yeah, I'm a big proponent of definitely incorporating a good fitness stretching type routine. And if it's not helping, then go see a physical therapist or see a specialist like myself, let's say, to evaluate that further.
I'm going to call you the fountain of youth because I've done all this stuff, and then I'm running one day and bam, it goes out. The joint just goes out. I just worn it down over years and years of time. But I'm not ready to have surgery.
Right.
So you specialize in something called regenerative medicine, and that's brand new.
Yes. So yeah, the field has been around in and out in various forms. In fact, there's certain fields that are covering this. So the orthopedics are covering this for joints. My field with physical medicine rehabilitation and even pain management is incorporating this a lot of times for people that have other conditions that are more musculoskeletal related, overuse injuries, et cetera, et cetera. I see even plastic surgeons, dermatology using this for facial rejuvenation, let's say the vampire mask and so forth that I've heard about. But for what I use it for, a lot of times people will have, let's say, rotator cuff or knee condition. It's not a full tear of the cartilage, but there'll be a partial tear. So the best studies that are out there right now for, let's say, regenerative medicine techniques are usually for the knee and shoulder. But the other conditions, let's say heel pain, let's say elbow pain, and other areas can be used. There's right now the two segments that are starting to gain traction right now are something called PRP, or platelet-rich plasma, which incorporates just being able to, the process involves drawing out your own blood, so it's your own autologous blood that you use, and then you spin that process of the blood down through a centrifuge, and then you obtain a smaller fragment of clear, what we call PRP, that you re-inject into, let's say, a joint, let's say a knee joint, shoulder joint. And I've done it to myself. I run, as part of my training, I do marathons. And I remember doing a marathon a week after I injected myself, and my season went well after that. So PRP is a very simple process to begin, its initial process. And then there's a more advanced process called stem cells, which basically stem cells are, you're able to obtain that from three sources. You can obtain them from the bone marrow, let's say down here, where you basically have to aspirate bone marrow tissue. You can also incorporate it from adipose tissue, which is essentially fatty tissue, and also you can incorporate it from fetal cells, or from amniotic fluid, which is a little controversial right now. I tend to think that the bony tissue is probably going to be the best route for obtaining that. And then you can incorporate that into the same process, let's say joints, shoulder joints, knee joints. I had a patient of mine who actually had a hip joint, and she did well as well with the small tear of the labrum, we call that.
Yeah, I've heard a lot of people with stem cell therapy for their hip. I had a girlfriend who had tendonitis here in her thumb, and she had stem cell therapy there, and it helped. What's a stem cell? I hear so much about this.
So stem cell is just a progenitor of a cell that can basically it can basically go into any route. So you can obtain the cell itself can basically morphize into something that will assist with regeneration is really what it is. And so you can obtain it from different sources, but those are the most common sources that you can obtain in. But the beauty of the stem cells is that it can incorporate regenerative qualities where basically it'll regenerate part of a cartilage. It won't incorporate the entire cartilage, it won't regenerate the entire bone, but if you have a smaller pathology and so forth, you can basically try to see if that will incorporate or regenerate part of that tissue back. Okay. And so that's how it works.
That's amazing. So you take these cells that people have in their own body and you inject it into a space where it has the power to, it sounds like science fiction, to regenerate and heal that area without surgery.
Correct, without surgery. And even I think the orthopedic surgeons are doing surgery and still injecting stem cells after the surgery is done in order to assist with the process of surgery, the healing phase of that.
Does insurance cover for that?
It does not. So right now there's a lot of regulatory
I'm sure because it's new.
It's newer right now, and I don't anticipate the insurances will cover this because it's such a controversial topic right now. But I mean, there are practitioners that are doing it properly that are able to show some benefit for patients who, let's say, are not a candidate for surgery or further surgery, or do not want any surgery at all.
Sure, and you know, insurance keeps saying we need to have evidence that it is therapeutically effective, and in order to gain evidence, we just have to run the numbers. We have to build those cases,
Exactly.
And that takes time to do it correctly.
Correctly. And so there are some practitioners who maybe over advertise or market what PRP or stem cells will do, and I think to a certain degree there needs to be some regulation of that, and I think the government has intervened in that process. So, you know, I think there's, like they say, the plastic surgeons, the dermatologists, I think, are using the regeneration of skin cells, let's say the vampire mask and so forth. I think it does show promise, but it's a temporary thing. It's not a permanent thing.
Well, I think it's interesting. We as physicians, oh my goodness, since the 1500s, have been trying to protect the public against individuals who sell snake oil.
Right, exactly. And there's a lot of snake oil out there. Absolutely. And you have to be vigilant. These days with social media, though, it's nice because I believe in the educating my population, patients that see me. I put things on my Facebook, LinkedIn sites, my website, in order to teach the patient about what is the science behind what I do. And
so you use your Facebook to kind of
educate.
Yeah, and get rid of all that pseudo medicine out there.
Right. That way, the patient a lot of times comes in with, "Gee, I heard about this and this and this," and I have to explain to them, well, the theory on that is such and such, but here's the real data. And so I tend to tell them that this might be a better source. This is something you may want to read about. Educate yourself about this, and then I'll explain things. I use props a lot of times in the office in order to explain. I use pamphlets that I can go over the anatomy of the problem they have, and then we talk about those options and so forth. But a lot of my patient population is sports medicine. And so I'm a weekend warrior, just like a lot of other patients. So I can relate to a lot of problems when they have certain ailments, and I see them for that. And I say, well, I don't like to be out of the game, let's say. And so I understand your concept, and I see a lot of either professional athletes or amateur athletes as well. And so I'm always empathetic to their cause.
I think that's amazing. I mean, I think somebody who is a person who is wanting to keep their body fit and young, just because they enjoy that so much, should come and talk to you and find out more things about growth hormone and nutritional supplements. I mean, it's an entire whole field. If people need to get a hold of you to talk to you more about keeping the body fit, or even to talk to you about when it does wear down, like
Right.
mine keeps doing all the time,
Right.
how do they get a hold of you?
So my practice is University Spine and Sports Specialist. I also have another practice called Volunteer Comprehensive Health and Regenerative Medicine. You can get a hold of me, and my office number is 865-690-3737. I also have a website which I cover. It's www.usss.volunteercomprehensivehealthregenerativeMedicine.com. And so be happy to discuss any issues you may have.
Thank you.
Okay, thank you.
So that's a wrap.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.